Hi everybody. Today we are going to talk about hypertension or high blood pressure. So what actually is blood pressure? Blood pressure is the pressure or the force exerted by the blood on the walls of the arteries. And so the excessive force exerted by the blood on the walls of the arteries is what the hypertension means. So now what are the clinical features, or you can say signs and symptoms of hypertension or high BP? A person may experience headache, double vision, lightheadedness. He may experience nausea. He may experience vomiting, chest pain. He may experience lightheadedness or dizziness, etc. etc. So, if you have any of these features, do consult your doctor for your BP checkup and all such things. So, what are the types of hypertension? Hypertension is broadly divided into 3 or 4 categories. The first one is the primary hypertension or the essential hypertension. Um, Second one is the secondary hypertension, or which occurs because of disease in some other organ of the body, and such that if that pathology is corrected, the hypertension gets corrected. The third one is the malignant hypertension, which is excessive BP rise to the tune of greater than 180 by 120. Malignant hypertension may occur in certain adrenal tumors, such as pheochromocytoma. So, the control of pheochromocytoma may be a remedy for malignant hypertension. What are the types of hypertension? Hypertension may be pre-hypertension, or stage 1, stage 2, or the stage 3. The normal BP is round about 120 to 80. Pre-hypertension is somewhere 120 to 139. Upon the systolic BP and the diastolic BP, 80 to 89. So this comprises pre-hypertension. Actually, the stage 1 hypertension starts when your BP rises above 140 by 90. The range is roughly between 140 by 90 to 160 by 100. This is stage 1 hypertension. Then the stage 2 hypertension. Stage 2 hypertension is normally more than 160 the systolic BP and 100 the diastolic BP. And then the stage 3, which reaches to the tune of malignant hypertension, and that is roughly greater than 180 millimeters Hg the systolic BP, and 110 above 110 the diastolic BP, greater than 110 the diastolic BP. So what are the various causes of hypertension? What may cause high BP? There are several factors which may lead to essential hypertension, and let me tell you, this essential hypertension, which is an interplay of several factors, is not right now curable. Some of the factors for essential hypertension are genetic factors. Your first degree relative may be affected with hypertension, so there is genetic preponderance. Then obesity, sedentary lifestyle, stress, taking more of excessive alcohol abuse or caffeinated drinks such as tea, coffee, or aerated drinks, soft drinks, eating junk food. Apart from this, exercise also plays a lack of exercise also plays a role in the development of hypertension. About 30 minutes of brisk walking daily maintains the health of your heart, so one should practice that. Apart from this, the stress factors, the smoking, all should be avoided just in order to decrease the risk of hypertension. Now, coming to the treatment of hypertension. The essential hypertension right now is not curable, and there are modifiable risk factors as well as the unmodifiable risk factors. So the modifiable risk factors may be are those which can be modified, such as lifestyle changes. Obesity may be controlled, weight reduction, quitting smoking, quitting alcohol, excessive alcohol abuse, and all such things. Adequate exercise may be practiced. These are modifiable risk factors. But then the genetic factors, are unmodifiable risk factors. Genes are unmodifiable, and so these are some of the factors which cannot be modified. Then the cure for secondary hypertension, which is secondary hypertension, as I told you, happens because of some other disease in the some other organ of the body, such as kidney disease. Your kidneys may fail, leading to hypertension. So if there is so if the kidneys are treated, the kidney failure is treated, or you can say somehow the kidney is replaced, the normal kidney is replaced. So the hypertension associated, which was associated with the pathological kidney, that may be reversed. Also, the malignant hypertension, which is high grade hypertension associated with pheochromocytoma, which is an adrenal tumor, if it is controlled, your hypertension may be brought under control. So this was in today's video something in brief about hypertension. See you in the next video. Thank you.